Some of the ways doctors can contribute to stigma is having fixed ideas of what people struggling with substance use look like. And so that can blinker us to detecting it in patients who don't look like the way we think that they may.
Can you always tell who has alcohol or drug issue? No. It doesn't come in same shape or size or form. It doesn't have a stereotype. It touches people from all backgrounds and cultures.
The typical patient of a drug and alcohol user is basically anybody. So it can be someone adolescent, it can be a family man, it can be a mum, it can be a grandma, it can be anybody.
So I've seen people from all walks of life who struggle with addiction issues. It could be a single parent who, is working 2 jobs and they're just needing to use substances to get them through. It could be people who are mentally unwell, people who are homeless, people who have gone through a significant grief or loss. I think if we start to try and create this blueprint or criteria of what a typical client looks like, it becomes quite othering, because it can affect just people from all walks of life.
I would say no, there's no such thing as a typical client. I've worked in the stabilization program with individuals that were doctors, lawyers, teachers, just the whole gamut, tradies, and no, there's no typical client.
A typical client with drug or alcohol treatment needs may be young, they may be old, they may be in the middle, they may be male or female or other genders, and they may also come from any number of different cultural backgrounds. One thing I would say, thinking about a typical drug and alcohol client, is that they do have commonalities, and by understanding some of those commonalities, in the case of chronic and really problematic drug and alcohol use, may be backgrounds of trauma, abuse, and significant personal problems and challenges and struggles within their family.
Once you've learned to remove the stigma and the judgment out of substance use, is that these people are just normal people with very interesting stories to tell and their own health needs.
Drug and alcohol issues affect anyone across the board. Could be corporate executive, put together mom, a teenager who's mastered the art of hiding their pain. Substance use challenges across any boundary. I think it could be race, income, education, someone with a stable job, stable housing, or someone struggling visibly on the street. I think there's no typical client, and it's never how they look, it's more about what they need. And I would take the weight off them and make it into an issue that we can all share and try and help them deal with as a collective community.